Good morning, everyone. This is Reshma Ramesh, and I'm here to talk about necrosis. So, necrosis is of five types, and I'm going to talk about the first two, coagulative and the liquefaction. So, necrosis is the localized area of death of tissues followed by degradation of tissue by hydrolytic enzymes liberated from the dead cells. So the dead cells release hydrolytic enzymes which in turn leads to the degradation of the tissue. Necrosis is always accompanied by inflammatory reaction in contrast to apoptosis where inflammation is not seen. So the causes of necrosis are hypoxia, chemical agents, physical agents, microbial agents, and immunological injuries also. This is the microscopic appearance of necrotic tissue. So the affected areas will be in white, gray, or yellow in color. Affected area can be easily differentiated from the healthy tissue. So here the affected area is more eosinophilic. Cells are swollen. So there can be visible changes in the nucleus. The nucleus may show condensation, which means pycnosis, that is the nucleus shrinks, which means the chromatin material condenses, and then fragmentation is seen, which is called as karyorrhexis, and the nucleus may also disappear, which is known as karyolysis. The chromatin of the nucleus fades due to the loss of DNA by degradation. So this is a necrotic affected patient's oral cavity. So the necrotic ulcer, the A image indicates a necrotic ulcer in the gingival mucosa spread from the alveolar process into the buccal mucosa. So B is the picture after 6 months or later the treatment. So this is the histological diagram of necrosis. So we have five types of necrosis, namely coagulative, liquefaction, caseous, fat, and fibrinoid. Moving on with coagulative necrosis. Coagulative necrosis is the most common one. Coagulative necrosis is a condition of cell death that is caused due to lack of blood flow. Coagulative necrosis can occur in any cell of the body, but it occurs most commonly in the heart, kidney, or spleen. Cells that undergo coagulative necrosis can become dry, hard, and white. Coagulative necrosis is caused by poor blood flow to a part of the body. If blood flow is reduced to a certain part of the body, the cells in that part of the body will not receive enough oxygen and nutrients, which may result in the death of cells. It occurs due to ischemia. The architectural outlines persist, but the cellular details are lost. That is, the architectural outline of the cell persist in case of coagulative necrosis, but the cellular details of the affected cell is lost. This outline persists because initially there is denaturation of the structural proteins, which is followed by the denaturation of enzymic proteins, which in turn blocks or inhibits proteolysis. So the left side diagram is the normal diagram of a kidney. This is how a normal kidney will be seen. Whereas the second diagram, the right side diagram, is the coagulative necrosis affected kidney. Okay, so the causes of coagulative necrosis are bacterial toxins like Fusobacterium necrophorum in livers of cattle, ischemia due to thrombosis or embolism as in infarcts, necrosis of renal epithelium due to poisoning from mercuric salts. So this is how the affected organ looks grossly. So the macroscopic appearance of an area of coagulative necrosis is a pale segment of tissue contrasting against surrounding well-vascularized tissue, and it is dry on cut surface. The tissue may later turn red due to inflammatory response. So as I said earlier, necrosis is always accompanied by inflammatory response, because of which the tissues turn red in color. So this is the microscopic appearance of. So this is the microscopic appearance. So the normal cells are converted into tombstone. That is, the cell outlines are only retained, whereas the cell details are completely lost. Cytoplasmic and nuclear details are also lost. The necrosed cells are swollen and they appear more eosinophilic. The necrosed focus is infiltrated by inflammatory cells, and the dead cells are phagocytosed by macrophages. Cytoplasmic and the nuclear details are lost, due to which it appears to be like a tombstone. So, liquefactive necrosis. It is caused by bacterial or fungal infections. So, liquefactive necrosis is a type of necrosis in which the dead tissues turn into a liquid substance. This condition usually occurs in central nervous system, especially in the brain. During necrosis, cells in the body die, and sometimes these cells are digested by lysosomes too, which are enzymes found throughout the body. When these necrotic cells are digested, a cyst filled with a liquid or pus-like fluid can form as a byproduct. Liquefactive necrosis is often linked with an abscess formation, and most frequently in the brain. Abscesses are nothing but swollen areas in the body that are filled with pus or any other liquid fluids. Liquefactive necrosis is also caused due to reduced blood flow to the central nervous system. It occurs due to degradation of tissue by the action of powerful hydrolytic enzymes, for example, lysosomes. So this is the gross appearance of liquefactive necrosis affected brain. So as we can see here, there is formation of abscesses where it is a cavity filled with fluid. So this is the microscopic view of liquefactive necrosis. The left side diagram indicates the normal tissue, whereas the right side diagram indicates the affected tissue. So grossly, the liquefactive necrosis affected organ is soft with liquefied center containing necrotic debris. Later, a cyst wall is also formed in it. Microscopically, the cystic space contains necrotic cell debris and macrophages filled with phagocytosed materials. The cyst wall is formed by proliferating capillaries and inflammatory cells. Thank you.